Eco-laboratory animal facility. What are the core principles of biosecurity to minimize the spread of zoonotic diseases, and how can the use of personal protective equipment (PPE) mitigate risks? Answer. The core principles of biosecurity in a laboratory animal facility aim to prevent the transmission of diseases between animals, humans, and the environment. These principles include access control. Limiting entry to authorized personnel only helps minimize exposure to pathogens. Zoning. Dividing the facility into clean and dirty zones ensures that potentially contaminated areas do not come into contact with clean ones. Hygiene protocols. Frequent hand washing, using sanitizers, and avoiding touching face areas help reduce pathogen spread. Personal protective equipment (PPE), such as gloves, masks, gowns, and boots, serve as barriers against pathogens, protecting workers from direct contact with animals or contaminated surfaces. Disinfection and decontamination. Implementing procedures for disinfecting animal cages, equipment, and work surfaces is essential to kill any potential pathogens. Waste management. Proper segregation and disposal of biohazardous waste help prevent cross-contamination. PPE is crucial in mitigating risk because it prevents physical contact with potentially infected animals, their excreta, or contaminated surfaces, which could otherwise lead to the spread of zoonotic diseases. The use of PPE minimizes the chance of workers becoming infected or unknowingly transmitting diseases to other animals. Relevant rule. The ISO 35001/2019 provides a framework for biosecurity management, especially in laboratory settings, emphasizing the importance of hygiene practices and protective measures. Dr. Naomi is supervising the quarantine of a group of macaques imported for biomedical research. On the fifth day, one animal exhibits symptoms of lethargy and nasal discharge. The facility's biosecurity plan mandates daily health monitoring. How should Dr. Naomi proceed to ensure compliance with quarantine protocols and prevent an outbreak? Answer. In this situation, Dr. Naomi must act immediately to contain potential risks and follow the facility's biosecurity protocols. Isolation. Immediately segregate the symptomatic macaque from the others to prevent potential transmission of any infectious agent. Health monitoring. Increase monitoring for all animals, ensuring that no other animals display similar symptoms. Veterinary consultation. Contact a veterinarian to conduct diagnostic testing to identify the cause of the symptoms, including potential zoonotic diseases like tuberculosis or respiratory infections. Infection control. Review the facility's biosecurity measures to identify any potential lapses in sanitation, PPE use, or quarantine practices. Documentation and reporting. Maintain detailed records of the symptoms and actions taken, and report the situation to relevant authorities if the disease is notifiable. Dr. Naomi should take all necessary precautions to ensure that the outbreak does not spread. The quarantine period should be extended for all animals until further testing confirms the health status of all individuals. Explain the ethical considerations and decision-making frameworks used in managing invasive research procedures involving rodents. Answer. When conducting invasive research on rodents, several ethical considerations must be addressed to balance the scientific goals with the welfare of the animals involved. These include the 3 principle replacement. Researchers should first consider alternative methods, e.g. in vitro testing or computer simulations, to avoid using animals. Reduction. The number of animals used should be minimized while ensuring that the study's results are statistically significant. Refinement. Techniques should be refined to minimize animal suffering and distress, such as using less invasive methods or better anesthesia protocols. Ethical review. An institutional animal care and use committee (IACUC) should review and approve all research protocols involving animals to ensure that the procedures are ethically justified and adhere to relevant standards. Pain and distress. Any procedure that causes pain or distress should be avoided or minimized, and pain relief methods, e.g. anesthetics or analgesics, should be used whenever possible. Necessity. The research must justify the use of animals, meaning the potential scientific or medical benefits should outweigh the ethical costs. Public accountability. Ethical guidelines like the Guide for the Care and Use of Laboratory Animals promote transparency in research. This includes publishing results and ensuring ethical standards are met throughout the study. These frameworks ensure that animal welfare is considered while still enabling important scientific discoveries. A rat colony has developed a respiratory disease. Outline the cleaning and disinfection protocols necessary to control the outbreak. Answer. To control the outbreak of respiratory disease in a rat colony, stringent cleaning and disinfection protocols are necessary. Isolation. Immediately isolate affected animals in a quarantine area to prevent the disease from spreading to healthy individuals. Disinfection. Use hospital-grade disinfectants known to kill respiratory pathogens, e.g., quaternary ammonium compounds, bleach, to clean all surfaces and equipment. Disinfect cages, drinking water systems, and animal enclosures daily, ensuring thorough contact with all surfaces. Ventilation. Improve air circulation in the affected area, ensuring proper filtration to reduce the potential for airborne transmission. Personal protective equipment, PPE. Staff should wear gloves, masks, and gowns to prevent cross-contamination when handling infected animals or cleaning areas. Deep cleaning. Conduct of thorough cleaning of the entire facility, including walls, ceilings, and floors, to remove any traces of pathogens. This should be done using hot water and an approved disinfectant to ensure effective decontamination. Waste management. Dispose of contaminated bedding, food, and other waste materials in sealed biohazard-approved containers. By following these cleaning and disinfection procedures, the spread of the disease can be minimized and the health of both the animals and staff will be safeguarded. Relevant rule. ALAC international standards for facility management provide detailed protocols for maintaining cleanliness and disease control in animal care settings. Mr. Logan is overseeing a wildlife rehabilitation center. He receives an injured fox suspected of having rabies. Local laws mandate specific protocols for handling such cases. What immediate steps should Mr. Logan take? Answer. Mr. Logan must follow specific protocols to manage the suspected rabies case in compliance with local laws. Isolation. Immediately isolate the fox in a quarantine area separate from other animals to prevent potential exposure. Notification. Inform local health authorities and the relevant public health department about the suspected rabies case. Rabies is a zoonotic disease, so the authorities will provide guidance on next steps. Veterinary care. The fox should undergo thorough examination by a veterinarian to confirm or rule out rabies, which may involve testing saliva, blood, or brain tissue. Protective measures. All staff involved in handling the fox must use appropriate PPE, e.g., gloves, masks, and face shields to minimize the risk of exposure to the virus. Euthanasia. If rabies is confirmed, humane euthanasia should be performed following ethical guidelines and local regulations to prevent further suffering and potential public health risks. Relevant rule. WHO rabies control guidelines provide internationally recognized protocols for handling and controlling rabies in animals. Describe how risk assessment is conducted in developing an emergency response plan for an outbreak in an animal facility. Answer. A risk assessment for developing an emergency response plan in an animal facility involves several key steps. Hazard identification. Identify potential hazards such as zoonotic diseases, e.g., tuberculosis, environmental threats, e.g., fire or human factors, e.g., staff negligence. Likelihood analysis. Estimate the probability of an outbreak occurring based on historical data, previous outbreaks, or trends in animal health. Impact assessment. Analyze the potential consequences of an outbreak considering factors such as human health, animal health, public safety, and economic impact. Mitigation strategies. Develop proactive strategies including vaccination programs, quarantine protocols, PPE use, and sanitation practices. Contingency planning. Create contingency plans for how the facility will respond if an outbreak occurs, such as evacuation procedures, resource allocation, and communication protocols. By conducting a thorough risk assessment, the facility can anticipate potential issues and develop effective plans to mitigate risks and respond swiftly to an outbreak. What are the philosophical differences between utilitarian and rights-based approaches in animal ethics, and how do they influence animal care policies? Answer. The utilitarian approach and the rights-based approach are two distinct ethical frameworks that influence animal care policies. Utilitarian approach. This approach focuses on maximizing overall well-being, often justifying the use of animals if the benefits outweigh the harm. The primary goal is to minimize suffering for the greatest number of beings, meaning that animals may be used for research or farming as long as the outcome provides significant benefits. Rights-based approach. This view asserts that animals have intrinsic rights, such as the right to live free from exploitation, regardless of human benefits. Policies guided by this approach often advocate for a complete abolition of practices such as animal testing or factory farming. The utilitarian approach might justify practices like animal testing if it contributes to medical advances, while the rights-based approach would oppose such practices on the grounds of animal rights. What is the significance of quarantine duration in preventing disease spread, and how is it determined? Answer. The quarantine duration is crucial in preventing the spread of infectious diseases by allowing for the identification of any latent or emerging symptoms that could indicate disease transmission. Its significance lies in infection control. A proper quarantine period helps identify and isolate infected individuals before they can interact with healthy animals or humans, reducing the risk of outbreaks. Pathogen eradication. Quarantine allows time for decontamination of facilities, including cleaning and disinfecting surfaces, equipment, and animal enclosures. The duration is typically determined based on the incubation period of the disease, which is the time between exposure to the pathogen and the appearance of symptoms. It is also informed by epidemiological studies and disease-specific guidelines. For example, OIE recommends minimum quarantine durations based on the disease in question. Compare the ethical responsibilities of veterinarians and animal technologists when addressing animal welfare concerns. Answer: veterinarians and animal technologists share a duty to ensure the health and welfare of animals, but their roles differ in scope. Veterinarians: they diagnose, treat, and prescribe care for animals. They are responsible for making critical medical decisions, including administering treatments, pain relief, and euthanasia. Veterinarians must uphold high ethical standards by ensuring that medical procedures are justified and in the best interest of the animal's well-being. Animal technologists are responsible for implementing care protocols, maintaining animal habitats, and monitoring health. They report any signs of distress or illness to veterinarians and must ensure the animal's daily needs are met. They are also tasked with following protocols for ethical treatment and ensuring compliance with relevant laws and regulations. Ethical responsibilities include adherence to the AVMA principles of veterinary medical ethics and reporting any welfare concerns that arise. Both roles must act in the best interests of the animals under their care. How do social behaviors influence animal health in group living species, and what management strategies can mitigate negative impacts? Answer: in group living species, social behaviors significantly influence individual and collective health. Stress from hierarchy. In social groups, dominant-subordinate relationships can cause stress in subordinate animals, leading to health issues such as immune suppression or behavioral problems. Aggression. Social conflict can lead to injuries, especially in species like primates or rodents. Spread of disease. Close physical contact can facilitate the rapid spread of infectious diseases within groups. Management strategies include social environment control, ensuring appropriate space and enrichment to minimize stress and aggression. Health monitoring, routine checks to identify early signs of disease or stress. Animal grouping, carefully monitoring group dynamics and adjusting group compositions to prevent conflict or dominance issues. Explain the differences between pharmacokinetics and pharmacodynamics in the context of veterinary drugs. Why is understanding both important when determining a drug regimen for animals? Answer: pharmacokinetics refers to the study of how a drug moves through the body, including absorption, distribution, metabolism, and excretion of meat. For example, the bioavailability of an oral drug depends on its absorption in the gastrointestinal tract and its first pass metabolism in the liver. Pharmacodynamics deals with how the drug affects the body, including its mechanism of action and the relationship between drug concentration and effect. Understanding pharmacokinetics ensures appropriate dosing intervals and routes of administration, while knowledge of pharmacodynamics ensures that the drug will achieve the desired therapeutic effect without causing toxicity. For example, aminoglycosides have a narrow therapeutic window, and errors in dosing can lead to nephrotoxicity. Veterinary drugs often have species-specific pharmacokinetics requiring adjustments. Cats, for instance, lack certain liver enzymes, making them more susceptible to toxicity from drugs like acetaminophen. Dr. Bennett is managing a farm experiencing unexplained weight loss in its livestock. Initial clinical examinations are inconclusive. The farm has a history of parasitic infestations, but the current symptoms don't align. Dr. Bennett decides to conduct laboratory diagnostic tests. Which diagnostic approach should be prioritized and why? Answer: Dr. Bennett should prioritize molecular diagnostics, such as PCR, polymerase chain reaction. The rationale includes specificity and sensitivity. PCR can detect pathogen-specific D9 even in low concentrations, making it superior to traditional methods when symptoms are unclear. Elimination of parasitic causes. If parasitic infestations are suspected, PCR can confirm or rule out specific parasitic DNA in blood or stool samples. Wide diagnostic scope. PCR can simultaneously test for multiple pathogens, addressing the differential diagnosis efficiently. For instance, if John's diseases A concern, real-time PCR can detect Mycobacterium avium subspecies paratuberculosis. Similarly, if viral pathogens are suspected, PCR panels can identify specific viral genomes. Guideline reference. Molecular diagnostic techniques follow ISO 17025 standards for laboratory testing accuracy. Describe the role of epidemiological surveillance in managing infectious diseases in animal populations. What are the two primary types of surveillance and how are they applied? Answer. Epidemiological surveillance is the systematic collection, analysis, and interpretation of health-related data to monitor and manage disease in animal populations. The two primary types are passive surveillance, relies on routine reporting of cases by veterinarians or farmers. Cost-effective and useful for baseline disease incidence. Limitation. Risk of underreporting and delayed response to outbreaks. Active surveillance involves proactive data collection such as targeted sampling of high-risk populations, ideal for early outbreak detection and monitoring the effectiveness of control measures. Examples include sentinel surveillance monitoring specific groups and serological surveys. Application example: during an avian influenza outbreak, active surveillance could involve regular testing of poultry farms near known cases to contain the spread. YZ LISA preferred over other immunoassay techniques in diagnosing certain zoonotic diseases. Discuss its limitations and scenarios where alternative techniques might be more appropriate. Answer. ELISA, enzyme-linked immunosorbent assay, is widely preferred due to high sensitivity and specificity. It accurately detects specific antigens or antibodies. Scalability, suitable for large-scale testing, which is crucial during outbreaks. Quantification capability. ELISA quantifies antigen-antibody levels, aiding in disease progression assessment. Limitations. Cross-reactivity. False positives can occur due to antigenic similarity between pathogens. Complex preparation requires well-prepared antigens or antibodies limited to known targets. Cannot identify unknown pathogens. Of alternatives: Western blotting for confirmatory testing in diseases like Lyme disease, PCR for pathogens with low antigenic loads. Guideline reference. The LISA protocols often adhere to OAE, World Organization for Animal Health diagnostic standards. MS. Carter manages a wildlife sanctuary. A rare bird species in her care shows neurological symptoms and difficulty flying. Imaging techniques are suggested. Which imaging modality should she consider, and what are the ethical considerations in this context? Answer. MRI, magnetic resonance imaging, is ideal due to its ability to provide high-resolution images of soft tissues, including the brain and spinal cord, without ionizing radiation. Ethical considerations include stress to the animal. Sedation or anesthesia may be necessary, requiring informed consent from the sanctuary management. Justification of procedure. The potential benefit of diagnosing and treating the condition must outweigh the risks involved. Cost and accessibility. MRI can be expensive and logistically challenging. The decision should align with conservation priorities. Guideline reference. Procedures should adhere to AVMA, American Veterinary Medical Association, guidelines on animal care and use in research and diagnostics. Compare and contrast horizontal and vertical transmission of infectious diseases in animals. Provide examples of each. Answer. Horizontal and vertical transmission are two distinct modes of pathogen spread in animal populations. Horizontal transmission refers to the spread of infectious agents between individuals of the same generation. This can occur through direct contact, G. Grooming, biting, mating, indirect contact, G. Shared food or water contaminated surfaces or through vectors, G. Mosquitoes, ticks. An example of horizontal transmission is the spread of foot and mouth disease among livestock. It can also occur via environmental routes like contaminated water supplies or surfaces that infected animals may have used. Horizontal transmission is typically more common and facilitates rapid spread within a population. Vertical transmission, on the other hand, involves the transmission of a pathogen from parent to offspring, either during pregnancy, birth, or via lactation. This mode is particularly relevant for congenital infections. An example is bovine viral diarrhea vira (EEV), which can be transmitted from an infected pregnant cow to its fetus, resulting in congenital defects or death of the calf. Vertical transmission usually leads to the presence of disease in the next generation, making it a more persistent form of transmission in a population. In what scenarios would histopathology be more advantageous than molecular diagnostics in disease investigation? Answer. Histopathology is particularly advantageous when the objective is to examine tissue morphology and detect structural changes associated with disease. It is ideal for diseases that cause visible alterations in tissue architecture, such as neoplasms, chronic inflammatory conditions, or degenerative diseases. This approach allows pathologists to directly observe cellular damage, necrosis, and abnormal tissue growth, which can provide a clear diagnosis. Histopathology is also useful in situations where no specific pathogen is suspected, and the focus is on the overall health and condition of the tissues, such as in end-stage diseases or chronic conditions where the pathogen may no longer be detectable in the bloodstream. For instance, in cases of chronic kidney disease or autoimmune diseases, histopathological examination of affected organs can reveal the extent of damage, which may guide treatment decisions. However, in cases where a specific pathogen is suspected and needs to be identified at a molecular level, such as in the case of infections caused by low-level pathogens, molecular diagnostics like PCR would be more suitable. To discuss the public health implications of zoonotic diseases using rabies as an example, how can intersectoral collaboration enhance control measures? Answer: zoonotic diseases like rabies pose significant public health risks because they can spread between animals and humans, causing severe health consequences or death. Rabies, primarily transmitted through bites from infected animals, commonly dogs, affects the central nervous system, leading to encephalitis and death if not treated. The disease can be transmitted quickly in high-risk areas, especially in regions where vaccination coverage is low, leading to major public health concerns. Intersectoral collaboration is critical in controlling zoonotic diseases like rabies. Key areas include veterinary and public health collaboration. Veterinarians play a central role in vaccinating domestic animals, especially dogs, and monitoring wildlife populations for rabies. Public health officials must coordinate these efforts, particularly in regions with high incidence rates. Government and NGO. Government agencies can provide funding and policy support for rabies vaccination programs, while non-governmental organizations can help with outreach and education, especially in underserved or rural areas. Global partnerships. The World Health Organization, WHO, and the World Organization for Animal Health, OIE, work with local authorities to ensure vaccines reach areas with endemic rabies. International efforts aim for the elimination of dog-mediated rabies by 2030. Mr. Alvarez notices sudden deaths in his livestock. Upon necropsy, hemorrhagic signs are observed. Immediate biosecurity measures are implemented. What should be Mr. Alvarez's next step to confirm the diagnosis and mitigate risks? Answer: in this scenario, Mr. Alvarez should take the following steps. Report the case. He should immediately notify local veterinary authorities, as hemorrhagic diseases like anthrax or Rift Valley fever are notifiable diseases. This ensures that the appropriate authorities can help contain the outbreak and prevent its spread to other farms or regions. Conduct laboratory testing. Mr. Alvarez should prioritize laboratory testing, particularly PCR or culturing techniques, to identify the specific pathogen causing the hemorrhagic symptoms. PCR can detect pathogens like Bacillus anthracis anthrax, even in early stages of infection, confirming the cause of death. Implement quarantine. Mr. Alvarez must quarantine the affected livestock to prevent further transmission to other animals on the farm. This includes isolating sick animals, decontaminating affected areas, and restricting the movement of animals in and out of the farm until the cause of death is determined. Consider the use of antimicrobials or vaccines, depending on the diagnosis. Specific treatments or prophylactic measures such as antibiotics, e.g. for anthrax, or vaccines for zoonotic diseases may be necessary. Dr. Nguyen is the head of a research facility specializing in veterinary diagnostics. They receive samples from a farm where animals are showing respiratory distress. The laboratory staff are deciding whether to use PCR-based tests or serology for diagnosis. Which testing method would be more appropriate and why? Answer: in Dr. Nguyen's scenario, the decision between PCR-based tests and serology depends on the timing of the infection and the specific pathogen involved. PCR-based tests detect the genetic material, DNA or RNA, of the pathogen and are most useful during the early stages of infection when the pathogen is actively replicating in the body. PCR offers high sensitivity even for low pathogen loads. If Dr. Nguyen's lab suspects a viral or bacterial infection like Mycoplasma bovis or bovine respiratory syncytial virus (RSV), PCR would be the most effective as it can identify the pathogen in nasopharyngeal swabs or other tissues before the animal develops antibodies. Serology, on the other hand, detects antibodies produced by the immune system in response to infection. It is more useful for detecting past exposure to a pathogen rather than diagnosing an active infection. If the respiratory distress has been ongoing for some time and Dr. Nguyen suspects a chronic or past infection, e.g. parainfluenza 3 virus or bovine viral diarrhea vira EE, serology would be appropriate as it reflects the immune response to the pathogen. What is the role of Western blotting in confirming a diagnosis of a viral infection, and what are its advantages and limitations? Answer: Western blotting is a laboratory technique used to detect specific proteins in a sample. It is often employed to confirm a diagnosis of a viral infection by identifying viral proteins or antibodies against the virus. The process involves separating proteins from a biological sample, e.g., blood or tissue, using gel electrophoresis, then transferring them to a membrane. The membrane is incubated with antibodies specific to the target proteins, such as viral proteins. If the target protein is present, it will bind to the antibody, which is then detected by a secondary antibody that produces a visible signal. Advantages: high specificity. Western blotting can identify specific viral proteins, making it highly useful for confirming the presence of a particular virus, such as HIV or canine parvovirus, even in cases where PCR might give a false negative due to low viral loads. Confirmation of infection. It can confirm the serological presence of antibodies as seen in Lyme disease or viral proteins, making it particularly useful for identifying past infections. Broad use in research and diagnostics. It is a versatile method, widely used for confirming diagnoses in both humans and animals. Limitations: time-consuming and expensive. Western blotting is more labor-intensive compared to PCR or enzyme-linked immunosorbent assays, ELISA, which can result in longer turnaround times and higher costs. Requires high-quality samples. It is less effective if the sample is degraded, as protein integrity is critical for accurate results. Semi-quantitative. While Western blotting can detect the presence of proteins, it cannot always provide a quantitative measure of the infection, unlike PCR, which measures pathogen load directly. What are the key factors to consider in designing housing for large animal species in research facilities? Provide at least 3 examples. Answer: key factors include species-specific needs. Cattle require open spaces for natural behaviors, while swine need durable flooring to prevent hoof injuries. Ventilation and environmental controls. Temperature, humidity, and airflow must be maintained within the thermoneutral zone to prevent stress or respiratory issues. Sanitation and waste management. Easy-to-clean materials and systems to handle large volumes of waste are essential. Regulations such as those outlined in the Guide for the Care and Use of Laboratory Animals mandate adequate space, lighting, and environmental enrichment. Non-compliance could lead to increased stress, affecting research outcomes. Dr. Peters prescribes drug X, an antibiotic, for Max, a 5-year-old dog with a bacterial skin infection. The drug is labeled for cattle and is not specifically approved for dogs. After 2 days, the owner reports Max is lethargic and has stopped eating. What steps should the veterinary technician take, and what regulations govern the off-label use of veterinary drugs? Answer: when Max shows signs of lethargy and anorexia, the veterinary technician should assess the situation by reviewing the drug history, including dosage, route and timing of administration, and monitor Max's condition. Consult the veterinarian immediately to discuss the symptoms and evaluate the potential for adverse drug reactions. Record the adverse reaction and the actions taken in the patient's medical records, adhering to proper documentation practices. Off-label use of veterinary drugs is allowed under the Animal Medicinal Drug Use Clarification Act (AMJCA), provided it meets specific conditions. The veterinarian must ensure there are no FDA-approved alternatives for the intended condition in the species. The veterinarian must base the off-label prescription on sound scientific evidence, which may include published studies or previous clinical experience. Detailed record-keeping must be maintained, including patient details, dosage, and reasons for the off-label use. Describe the steps involved in maintaining proper record-keeping for controlled substances in an animal facility. Why is meticulous record-keeping critical? Answer: proper record-keeping for controlled substances in an animal facility requires inventory control, a system to track all controlled substances, documenting the quantity received, dispensed, and remaining. This includes a daily or weekly inventory check to ensure no discrepancies. Record of administration. For each dose administered, records must include the patient's identification, dosage, time, route of administration, and the signature of the veterinarian or technician. Secure storage. Controlled substances must be stored in a locked, secure cabinet or safe, accessible only to authorized personnel to prevent theft or misuse. Periodic audits. Regular audits are essential to verify inventory records against physical stock. Any discrepancies should be investigated immediately. Meticulous record-keeping is essential to ensure compliance with regulations such as the Controlled Substances Act (CSA). This law mandates that any facility handling controlled substances maintain a detailed log to prevent misuse and ensure accountability. Failure to comply can lead to severe penalties, including suspension of licenses, criminal charges, and loss of trust within the veterinary community. A new animal facility is being set up to house 20 primates for long-term research. During an inspection, the air conditioning system is found to be underperforming, resulting in a temperature of 29 in the housing area. What steps should be taken to rectify this situation, and what guidelines regulate such housing conditions? Answer: the veterinary technician should take immediate action to rectify the situation. Implement temporary measures while the system is being repaired. Portable air conditioners, fans, or ice packs could help lower the temperature and prevent heat stress in the primates. Monitor animal welfare. Assess the animals for signs of heat stress, such as excessive panting, lethargy, or aggression, and document any behavioral changes. Repair or replace the air conditioning system. The HVAC system should be promptly repaired or upgraded to meet the temperature and airflow requirements for primates. Guidelines for the proper housing of primates are outlined in the Guide for the Care and Use of Laboratory Animals. According to these guidelines, primate housing should maintain a stable temperature range that ensures the animal's health and minimizes stress, typically between 18 to 60. Exceeding these limits can lead to detrimental effects on the animals, including compromised immune systems and behavioral disturbances. Non-compliance with such standards could affect the validity of research results and lead to regulatory sanctions. Why is the intramuscular route preferred over the subcutaneous route for some veterinary drugs, and what factors determine this choice? Answer: the intramuscular route is preferred over the subcutaneous SC route in certain situations due to several factors. Faster absorption. IM injections are absorbed more rapidly into the bloodstream because muscles have a better blood supply than subcutaneous tissues. This makes IM suitable for drugs that require quick therapeutic action, such as antibiotics. In an emergency situation, drug formulation. Some drugs, particularly oil-based or viscous preparations, can cause tissue irritation or necrosis if administered SC, making IM administration safer and more appropriate. Volume of injection. Larger volumes can be injected into the muscle than under the skin without causing significant discomfort or damage, thus ensuring effective drug delivery. Factors such as the drug's chemical properties, the animal's size, and muscle mass influence the choice of administration route. For example, in larger animals, IM injections are typically more tolerable. However, the SC route may be chosen for drugs that require slower, sustained release, or in situations where the IM route is impractical due to anatomical or logistical constraints. What is the significance of understanding contraindications when prescribing an NSAIDs for small animals? Answer: NSAIDs, non-steroidal, anti-inflammatory drugs, are widely used for pain management in veterinary medicine, but understanding their contraindications is essential for patient safety. NSAIDs are contraindicated in animals with pre-existing kidney disease. NSAIDs can reduce renal blood flow, leading to renal failure in animals with compromised kidney function. Liver disease. NSAIDs are metabolized in the liver, and in animals with liver dysfunction, their clearance can be reduced, increasing the risk of toxicity. Gastrointestinal issues. NSAIDs may irritate the gastrointestinal tract, causing ulcers, bleeding, or perforation, particularly in animals with a history of gastrointestinal issues. In cats, NSAIDs like carprofen can be particularly harmful because the limited ability to glucuronidate drugs increases the risk of toxicity. Adverse reactions to NSAIDs can include vomiting, diarrhea, and even more severe complications like organ failure. Understanding these contraindications helps prevent unnecessary harm and ensures that the benefits of pain relief outweigh the risks. How does improper waste management in an animal facility affect research outcomes and animal welfare? Answer: improper waste management can have several negative effects on both research outcomes and animal welfare. Health hazards. Waste accumulation can lead to the proliferation of bacteria, fungi, and other pathogens, increasing the risk of disease transmission among animals and staff. This can directly compromise animal health and research data integrity. Environmental contamination. If biological waste or chemicals are not disposed of correctly, they may contaminate the environment, affecting local ecosystems and possibly leading to contamination of food or water supplies. Stress and behavioral issues in animals. Poor sanitation can cause stress in animals, affecting their behavior and physical health. Stress is a known factor in the disruption of research data, particularly in studies assessing neurological, hormonal, or immune responses. To prevent these issues, facilities must adhere to proper waste disposal protocols as outlined by PA and local environmental regulations. This includes using biohazard containers, regular cleaning schedules, and proper disposal of chemical and biological waste. What factors should be considered when allocating resources in an animal facility to balance operational efficiency and ethical standards? Answer: effective resource allocation in an animal facility requires careful consideration of the following factors. Animal welfare. Ensure adequate funding for high quality nutrition enrichment and veterinary care. Facilities should prioritize ethical treatment, which may include housing upgrades or providing species appropriate enrichment. Facility maintenance. Allocate funds for regular inspections and repairs to ensure the environment is safe, clean, and compliant with regulatory standards, such as those set by the Guide for the Care and Use of Laboratory Animals. Staff training and retention. Invest in training programs to ensure staff are knowledgeable in animal care, ethical research practices, and compliance with regulations. Sustainable practices. Budgeting for waste management systems, energy-efficient equipment, and sustainability initiatives can reduce operational costs in the long term. Balancing these factors ensures compliance with ethical standards, reduces operational inefficiencies, and enhances overall facility performance. Ethical concerns must be prioritized to meet animal welfare requirements, particularly under the 3Rs principle: replacement, reduction, refinement, which promotes the responsible use of animals in research. What considerations should be made when designing an animal facility to ensure species-appropriate housing and environmental conditions? Answer: when designing an animal facility, it is crucial to ensure that the housing and environmental conditions meet the specific needs of the species housed. Key considerations include space requirements. Different species require different amounts of space for movement, socialization and behavioral expression, temperature and humidity control. Each species has a preferred temperature range. For example, reptiles typically require a warmer environment, while many small mammals, such as rabbits, require cooler conditions. Humidity control is also important to prevent respiratory issues in certain species. Lighting. Some species, like nocturnal animals, need periods of darkness to mimic their natural environments. Additionally, light cycles should match the species' biological rhythms, as improper light exposure can affect their behavior and health. Ventilation and air quality. Good air circulation is essential to prevent the buildup of harmful gases like ammonia and carbon dioxide, which can be harmful to animals and staff. Socialization needs. Some animals, such as dogs or horses, require social interaction, while others, like cats, may need solitary spaces.